Start.
Hello, this is Dr. Trivedi, a doctor working in this clinic. May I confirm your name and age, please?
Hello, doctor. My name is Brown Holmes, and I'm 39 years.
Okay. How may I address you?
Please call me Holmes.
Okay, Mr. Holmes. Today we are going to discuss about your health issues. Is that all right with you?
Okay, doctor.
And during our discussion, I might take down some notes, which will be very strictly confidential. Is it all right?
Okay, doctor.
Okay. Now, Mr. Holmes, can you please tell me what have brought you here today?
Doctor, this is for last few months. I have noticed that I am getting some headache, and this is increasing day by day. This is so dull headache that I even cannot concentrate on my work properly. I thought that it will go away due to the some work stress. I took some paracetamol tablets, some ibuprofen tablets. They initially helped me a little, but the problem is increasing day by day, and it is not. I am not feeling better now. So I visited my CPA frequent times. He also gave me some tablets, paracetamol tablets, ibuprofen tablets, but that is not helping me. And after that, I talked again with my CP, and he thought that I need further evaluation. For that, he sent me here.
I'm very sorry to hear. I would try my level best to find out what's troubling you. Okay, may I know that uh, actually when did it start? How long back? Can you please specify?
Maybe 3 or 4 months.
Okay. And did it come along all of a sudden, or did it develop
No,
gradually?
it was gradually, and severity is increasing gradually.
Gradually. And how long, once it starts, how long does it persist, do you think?
It presents every day.
Every day. And for how long does it persist? All the time? Or is there any specific time of the day when it's more or less?
It's more in the morning, doctor. I think it
More in the
up to the midday.
more in the morning. Okay. And well, do you think that this headache goes to anywhere else in your body? Does it
No,
spread to anywhere else?
no,
Okay. And do you think that there is anything specific that makes it better or worse?
I cannot tell you exactly.
Okay. And now, can you please tell me that is it present in only one side or both sides of the head?
All over my head, doctor.
All over your head. And can you please specify and how is the pain? You told once that it's dull, but can you tell more about it, about the pain?
It is dull and boring, doctor.
Dull and boring. Okay, that's all right. And okay, may I ask you that you said that around 3 or 4 months back you had started this problem. At the time, did you had any head trauma or any accident? Can you please remember?
No,
Okay. Any raised temperature at the time?
no,
Any stiffness in your neck or changes in the vision?
no,
Okay. Any difficulties in your swallowing or speech?
no,
Okay. Any difficulty, any weakness in any parts of your body or any
no,
abnormal sensations?
no,
Okay. Any difficulty keeping balance?
no.
Okay. Well, one thing you mentioned that you think it's the pain is more in the morning. Am I right?
Yes, doctor.
Okay. Can you ever notice that there was any vomiting present or anything like that?
I feel little nauseated, but not vomited. But
Okay, that's all right. And have you noticed anything like bending or coughing mixing the worse?
think that it makes me some what discomfort when I bend. Nothing significant.
Bending. Okay, okay, nothing significant. Okay, that's all right. And may I ask you that has there been any changes in your weight?
Yes, doctor. Uh,
Okay, can you please tell me what happens?
I gained lots of weight. I think about 5 kg for the last 4 months.
5 kg for last 4 months. Okay, that's all right. Uh, may I know that was it intentional or unintentional?
Unintentional.
Okay. And have you had any weather preferences?
No.
Okay. And any okay, and any lumps and bumps anywhere in the body?
No.
Any night sweats?
No.
Okay. And do you have any cough?
No.
Any chest tightness on the chest?
No.
Have you ever coughed out blood?
No.
Okay. Any chest pain or shortness of breath?
No.
Okay. Any racing and pacing of your heart?
No.
Okay. And any leg swelling? Have you noticed?
No.
Okay. Or any swelling in your any lumps and bumps in your necks? Have you noticed of any?
No.
Okay. And now, may I ask you that have you noticed that there is any change in your size of the shoes or rings, like something like that
No.
recently? Okay. And okay, that's all right. And and have you noticed that your hands are getting more sweaty nowadays? Anything like that?
No.
Okay. And uh, okay. And may I ask you that do you have any rash anywhere in the body?
No.
Any joint pain in anywhere in your body?
No.
Okay. And okay, that's all right. And may I ask you that do you have what about your water walk? Is it all right?
Yes, doctor, I think it's all right.
Okay. Have you ever passed any blood in your water walk?
No.
Any frothiness, or do you think that you have to wake up at night for going to water walk?
No.
Okay. And what about your bowel movements?
I think it's fine.
Okay. Okay, that's all right. And at this point, may I ask you that do you have any known long-term diseases or any other diseases that you can mention?
Yes, doctor, I have high blood pressure and high blood sugar.
High blood pressure and heart. So, can you please tell me how long have you been facing these problems?
High blood pressure for last 10 years and high blood sugar for last 5 years.
Okay. And may I know that which medication do you take for these problems?
For high blood pressure, I take Remifril and like one chlorothiazide.
Okay. And for high blood sugar?
Uh, the one tablets are named metformin and insulin.
Okay. Metformin and insulin. Okay. May I ask that for how long have you been taking insulin?
For last 3 years.
Okay. Has there been any recent change in the dose of insulin?
No.
Okay. And may I ask you again that do you know about your control of blood pressure or blood sugar level? Is it well controlled? Do you know anything of it?
No, doctor, it is not well controlled. I cannot take the
Okay. What?
medications regularly.
Sorry.
I cannot take the medications regularly.
Okay. Okay. I'm very sorry to hear that. Okay. And may I ask you some other questions now? That you told that it's not under control. So, do you feel any? Okay. Okay. That's all right. And do you think that you get sweaty on and off, or any flushing on and off?
No.
Okay. And that's all right. And may I ask that are you allergic to any medication?
No.
You told that you take some ibuprofen or something like that. May I know? May I just know? Can you just remember again what you told about those ibuprofen and which medications?
Paracetamol.
Uh, Paracetamol.
Yes.
Okay. 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 And you told. Can you please tell me that have you ever had any overdose of these medications?
No.
Okay. And may I know that how many tablets do you take per day usually for
Uh,
your headache?
two paracetamol tablet and one ibuprofen tablet.
Okay. Have you ever had any overdose of these tablets?
No.
Okay. And any halal medication that you take?
No.
Okay. And okay. Okay. That's all right. And may I know that do you have anybody in the family having similar type of headaches or something like that?
No.
Okay. And may I ask you some more questions now? That do you smoke?
Yes.
How many sticks for how long?
Maybe about 10 sticks per day.
Okay.
last
And
20 years.
actually, smoking is very bad for your health, and it would be better if you stop smoking. If you want, I can refer you to smoking cessation clinic. Will it be okay?
Okay.
These are actually some personal questions. I may say that, no, that do you drink alcohol?
Yes, doctor.
Okay. Has there been any binge drinking?
Occasionally.
Occasionally. Okay. Actually,
So if
so
headache,
alcohol can be very bad, and binge drinking can also add to your problems. Okay, so it will be very important to stop drinking as well. Will it be all right for you?
okay, doctor.
Okay, and again, some personal question that may I know that do you have any recreational medication ever or any party drugs ever?
No,
Okay, and may I know that where do you live actually?
I couldn't get this question. Can you
Okay, okay. Where do you live? In the home where you live? Is it
apartment?
have you shifted? Sorry, have you shifted to your home recently?
No,
Okay, and okay, and uh, may I know that do you have any history, family history of diseases, known diseases?
no,
Okay, and may I know that have you been to try any travel to recent country, any country recently?
no.
Some personal questions, if you allow me. May I know that whom do you live with?
My wife.
Okay, okay, and okay, and may I know that have you ever had any partners
No.
other than your wife? Okay, that's all right. And at this moment, okay, may I know that you drive?
Yes, doctor. I am a school bus driver.
Okay, and what do you do for a living?
I'm a school bus driver.
Okay, okay, and may I know that what your concern is at this moment?
Why I am having this headache for a long time? I took this medication. I visited my GP, but it is not going out.
Yes, yes, I can get it. At this moment, actually, I will actually have to examine you more thoroughly and do some tests. But as long as I have taken history from you, I think that you might be mm, suffering from a condition named. Uh, I think you might
Yeah.
be. Okay, okay. Couldn't get the case.
So, have you reached at any diagnosis?
Uh, I think I've missed the diagnosis in this patient. The patient gained weight, so I think there can be some causes here. More in the morning, so it can be idiopathic intracranial hypertension. I think uh, this can be acromegaly, or this can be some steroid overuse. I think, but he didn't mention of any steroid drug use. And it can also be medication overuse headache, although there is no history of opioid. And others I cannot just remember at this moment. I'm very sorry, I couldn't get it.
Do you think that obstructive sleep apnea can be a cause of chronic headache?
Oh yes, this could have been a case cause chronic headache.
And obesity related hypoventilation syndrome?
Yes, yes, yes.
Have you did you ask any question regarding that?
No, no, no,
Okay,
no. This was a total failure.
patient already said you that this is a morning headache. So,
Headache.
what is your differential for the morning headache?
Morning headache differentials. It can be ICSOL. It can be IIH. Hmm. It can be
What do you mean by
OSA.
ICSOL and IAIs?
Yeah.
What do you mean by ICSOL IAIs?
Oh, intracranial spills, occupation, idiopathic intracranial hypertension, then obstructive sleep apnea. Hmm. And I think these are important.
Okay. So you haven't asked anything about obstructive sleep apnea.
I didn't ask anything. Anything. This was complete failure. Okay.
Suppose this is a case of obstructive sleep apnea. How will you investigate this case?
Okay. If suppose it's a case of okay. First of all, I will have to do some. I will have to do some routine blood test, including complete blood counts.
What do you expect
To
from
see
complete
any
blood count?
anemia. I think any anemia or any thrombocytosis or any infection present by doing looking at the neutrophil or lymphocyte counts. Then I would also like
Anything
to
else
do
do you
ESR.
expect?
Sorry.
Anything else do you expect?
Uh, yes, in observatory, I think polycythemia can also be expected.
Okay, then proceed. What are the
Okay.
tests?
Sorry.
What are the tests?
Yeah. Then I would like to do ESR and CRP level to rule out any inflammation present or not. Then I would like to do some CT scan of the head, and also thyroid function test, and arterial blood gas analysis, oxygen saturation level, and also polysomnography or sleep studies. Okay. And also I would like to do Epworth sleepiness scale. I think Epworth sleepiness scale, and I think. These will be the important investigations.
Do you like to do any CT scan of brain?
I told you the CT scan open.
Okay. And do you like to do urine examination, random blood sugar level, HbA1c level, serum cholesterol level?
Yes. All this must be done.
Okay. So, do you know that what are the risk factors or causes of obstructive sleep apnea?
Sorry.
What are the causes or risk factors for obstructive sleep apnea?
Yeah. Obstructive sleep apnea can be a sedentary lifestyle. Okay, due to obesity, simple obesity. Then it can be a peak weekend syndrome, and then it can be hypothyroidism and acromegaly or any other causes of weight gain.
Anything else do you like to add?
Anything else? I cannot remember.
Okay, tonsil, palatal palsy, they can also cause obstructive sleep apnea. And idiopathic is another cause.
Sorry. Idiopathic.
Yes.
Idiopathic is an important cause, no? Okay.
Okay. So, how will you manage this case? Suppose this is a case of obstructive sleep apnea.
Okay. First of all, I have to educate and counsel the patient, and then I will have to first of all, okay, then I will have to form a multidisciplinary team, including the including the neurologist, the occupational health therapist, and then I would have to respiratory physicians also, and then I might have to I will also have to give him some lifestyle advices to cut down the weight, and some food habit changes, and to cut down weight as well, and then to stop smoking and alcohol, and also I might have to go for some very specific treatments as well, like some mandibular advancement devices or CPAP. Okay, I think these might be important.
Do you know any pharmacological management or any
Yeah. I think
drug?
one pharmacological drug is quite popular. I think modafinil can be an important drug.
Okay, thank you.
Okay,
This was a case of obstructive sleep apnea.
this has been a total failure. I just couldn't get anything. There's a total. I was just thinking about XOL and IIH. That was such a okay.
Oh, it
That's all
was
right.
yeah, this
Even
was
you
a
told
case,
that there was
this
5
was
kg weight gain.
this was a case of morning headache. Patient was one erratic lifestyle. Okay. Uh,
Any other cause of morning headache? Can you please tell me?
these are the main three causes for exam at least.
Okay, and what about carbon monoxide poisoning?
Yes. Carbon monoxide at present,
Morning headache, no?
not morning headache, but can present at any time. More on the
Okay.
when staying at home or using furnace or using fireplace. At that time it occurs during the usually during the uh, what is called winter time or old vehicles when driving the old vehicles at that time, not present on.
Okay.
This is actually carbon dioxide retention headache. obstructive sleep apnea, COPD induced headache.
Mm. What? COPD induced headache? What? I couldn't get it. Can you please
Carbon
repeat?
dioxide retention headache. These are for carbon dioxide retention.
Yeah. Yeah.
Okay.
Yeah. Okay. Okay.
Obstructive sleep apnea. If you have asked about any sleep disturbance, then you could get the answer. Or
Yeah. This is a total failure. Okay. I I just forgot it. Okay. Okay.
and also
Any snoring during sleep, any sleepiness in the daytime.
and
Okay.
mood,
Any
mood,
sleep
mood,
disturbance is
also
specifically. I think these are important.
low mood. You should have asked about sleep habit, low
More.
mood, daytime sleepiness, especially he is a
Yeah.
driver, so if
Okay.
he has felt sleepy on during driving on the traffic on while waiting for traffic lights, okay, and while
Mm-hmm.
during taking food, and also his personal sexual lifestyle that in a problem with
Mm-hmm.
incompetence. Okay, fine.
Yeah. Okay. Okay. দাদা একদম মোটা
And also, you have to mention about the drug medication because he's taking drugs, paracetamol and ibuprofen regularly. So you should have that, and it will also be paused. So you should also review that and may need to reduce that medication.
Okay. Okay.